Another danger as we rush outside to enjoy the spring weather is the danger of the sun. Skin cancer is on the rise in the nation, especially in Kentuckiana. Meet a man who wants to pass on the lessons he's learned. When Tom Aubrey and his wife go for a walk on a lovely day, he is certain to be wearing a hat. He is much more careful about that since a recent bout with skin cancer.
Well, we were about ready to go to Florida, and I went to see Dr. Turner and had an examination. And during the examination, he found several spots which he addressed. And then he said there was one that looked suspicious to him, which was back here in my arm. And he took a biopsy of it. He said, "We'll send this in." There's also one down on my leg, my ankle. And he said, "We'll send these in and I'll get back and let you know how they turn out." And so I guess 3, 4, 5 days later, he called back and said that the one on the ankle was okay, but the one on the shoulder or on the arm here was melanoma. And so he said we're going to need to remove it.
Well, melanoma is a type of skin cancer, and it's the deadliest form of skin cancer. There are different types, including basal cell and squamous cell, but melanoma is the worst type.
Dr. Logan Turner is Tom's doctor.
Luckily, that melanoma was caught very early, in the earliest stage possible. And because of that, he had that lesion cut out, but there was no further treatment that was required.
He credits that good outcome to Tom's early detection. Tom makes a point to have a skin screening once a year.
You only get one shot at early detection, and I would encourage everybody to make sure that they at least go out once a year and get a scan of their body, because they can appear anywhere in your body. And it's an easy thing to do. It doesn't take 15 minutes, but it can make a difference in your life in terms of how long you're going to be here on this earth. So I would encourage everybody to do this. And you know, it can make, as I said, a major difference in your life.
Everyone should have an annual screening with a dermatologist. Just like they go to their physician for an annual exam, they should see a dermatologist every year for a skin exam. Everyone should use sunscreen.
Joanne Couch is a clinical educator at the Norton Cancer Institute Resource Center. Her mission is education and early detection. She is adamant that people should know the ABCs of skin cancer: asymmetry, a change in the shape of an area; border, a ragged or irregular border; and color, a change in the color of a spot. Even African Americans should be aware of these signs.
People with darker skin, quite often, you know, they have more melanin in their skin. So they have a little bit of protection, but they're still at risk. And African Americans can get skin cancer, but normally they may get the skin cancer in different places. Palms of their hands, soles of their feet, the spaces in between their fingers, their lips, around their eyes, because those areas are lighter. So they're at risk as well.
She is also adamant about tanning beds.
Let's talk about tanning beds and the dangers there.
If someone uses a tanning bed before age 30, they are increasing their risk of melanoma by 70%. No one should be going to a tanning bed. The use of tanning beds among teenagers is unbelievable, and we really don't seem to be right now making a headway with educating them, because we, in our society, we view a tan as beautiful. And, you know, when you're a young teenage girl, you know, you want to fit in, and they want that tan, makes them feel better, they look better. And some of them are going not only once a week or once a month, they're going several times a week. And those lamps that they use in the tanning beds, they will tell people, well, we're using UVA lamps, not UVB lamps. UVA lamps or UVA light is just as dangerous as UVB light. The difference is it does not cause that burn on the skin, so you don't see the redness that you would with a UVB burn. But UVA rays penetrate deeper into the skin.
The most important thing is sunscreen use. And I tell patients that they need to wear a sunscreen that's at least an SPF of 30, and it also needs to have broad spectrum coverage. So it needs to cover both UVA and UVB rays, which both contribute to skin cancer. That's the first step. The second step that I recommend is that they do not tan themselves. If they do want the look of tan skin, then I recommend either spray-on tans or the sunless tanners. But there's really no type of tanning that is safe for the skin.
I'm out in the sun quite a bit. I spend a lot of time outdoors. I walk a lot, and I love being outside. And I never wore sunscreen at all. And I did start wearing a hat when my hair started thinning in a certain spot of the head about 3 or 4 years ago. So I've been wearing a hat for a while. But I'm going to start wearing sunscreen. And my wife and I went over the other day to a retail shop and bought these long white shirts that have the sunscreen protection in them. So I'm going to start doing that. I've never done that before. And just be more careful about being out in the sun.
A lesson learned that he hopes to pass on to others. There will soon be a new facility available to treat those with skin and other cancers in Louisville. A new downtown radiation center is underway at Broadway and Floyd Streets. It will be the new Norton Cancer Institute Radiation Center. Norton executives at a groundbreaking say it will feature the most advanced technologies available anywhere in the world to treat adult and pediatric cancers and tumors.
This center will not only provide radiation services, but medical, gynecologic, behavior, and orthopedic oncology. We will develop multidisciplinary clinics, patient clinical trials, resource centers, and educational services